Hi, my name is Inga Thompson. I am the Present Secretary of the Prevention of Senior Abuse Network here in Simcoe County. COVID-19 has impacted us all over the world in many ways this year, but it has particularly had an impact on seniors, their caregivers, and healthcare providers that are trying to support them. Today we want to talk about how those three have been impacted by COVID and the impact that it has with regards to elder abuse. So just a quick thing about who we are. The Prevention of Senior Abuse Network here in Simcoe County is a network that is primarily run by volunteers. We're dedicated to educate people about awareness of elder abuse and responses and who's available to support them. We've been in existence since 1996. Elder abuse, as defined by the World Health Organization, is a single or repeated act or lack of appropriate action occurring within a relationship where there's an expectation of trust, which can cause harm, distress to an older person. There are various forms of elder abuse that can occur: physical abuse, financial abuse, sexual abuse, psychological, verbal abuse, and also neglect, which may be intentional or may be unintentional. So let's talk a little bit about how COVID has impacted on seniors. COVID itself has resulted in a lot of changes in the way that we connect with people. We limit this. There's a lot less interpersonal connections with people, and many seniors have been impacted by that. Seniors are at the highest risk for COVID. The latest study done in the States demonstrated that 1 in 8 senior over the age of 65 could die as a result of COVID. Seniors are also 8 times more likely to be hospitalized because of COVID than someone in their 20s. They are also likely to have more significant negative impacts on all these processes and procedures that are taking place in order to protect us from COVID. For example, the social isolation. They have limited ability for themselves or caregivers to offer the care and the support that they had. There's a disruption in their daily routines, and they have difficulty accessing, perhaps, the things that they need to stay healthy. It can impact on them financially. There may be some instability. Many seniors still work, and they maybe had to stop working during COVID, so they've got a loss of income. Many rely on their investments, their stocks, their bonds, and that's also fluctuated over the last year, which could have an impact on their income. Savings may have been impacted, had to tap into some of their savings in order to do that, and if that was their retirement fund, again, it's impacting on that. And unfortunately, they are often more vulnerable to financial scams. Physical and mental health can be affected by this. Many seniors have been afraid to go out and are not picking up the things that they need, not going to the doctors as frequently as they should, not going to emergency room if they need to go. So this can impact on their physical health. They may not be getting the supplies, the medication as consistently as they should, which can have an impact on exacerbating illnesses that they previously had. As far as mental health is concerned, it can impact on them from an aspect of anxiety, stress, depression. And for many, they've seen an increase in use of drugs and alcohol as ways of coping. In addition to this, there is ageism that has become very prevalent while COVID has been in existence. Many seniors are seen as helpless, frail, need to be protected, and taken away from the ability to make decisions. They've lost privacy, they've lost autonomy, and in some cases, lost their dignity. Now, just a little caveat with regards to the anxiety and depression. Interestingly enough, there was a study done just at the end of last year that took a look at community dwelling seniors. This was not seniors living in congregate living, retirement homes, long-term care. And in fact, they recognized that seniors were doing better with regards to anxiety than many of their counterparts, their younger counterparts. For example, in the 55-year-old age group, Only 6.2% of seniors reported feeling anxious as a result of the COVID. In the 18 to 24 age group, staggering 49% felt extremely anxious. 25 to 44-year-olds, 35.3%. And obviously, as they get older, there was less anxiety. The 45 to 64-year-olds, 16.1% reported feeling anxious. But as you can see, many of the seniors did not report that. So why is that? Some of the reason for that is because they were proactive. They avoided travel, they avoided going into public places, and they avoided being around sick people. They also had less interactions, and those interactions had more quality to them. They were more meaningful interpersonal relationships. They also just have wisdom. They have the ability to have empathy, compassion. They can regulate their emotions a little easier than younger people. They can self-reflect. They can take a look at what they need to do here. And they can make decisions. They are quite decisive. And as you get older, you tend to accept uncertainty in this world and other people's perspectives. Now, we have to appreciate that that was community dwelling seniors. They didn't study those who were living in congregate living, and it was perhaps in the early stages of this. It would be interesting to see if that continues now. So what can seniors do? Well, the first thing is stay healthy. Keep taking your medication. Make sure you've got your meds when you need them. In fact, it's easy to keep 30-day supply. Don't avoid going to the doctor or the emergency. All of them are set up with infection control procedures, so they're perfectly safe to go to. If you need to go to see a doctor, go see a doctor. Reduce your risk. Wear a mask, but wear it properly. Make sure that you do have it up over your nose and tucked in around your chin. Wash your hands frequently. They say make sure you wash your hands for at least 20 seconds, and you wash the top of your hands as well as the inside of your hands. Avoid touching your face. Disinfect surfaces regularly, and just make sure that your environment is safe. If you do need to go out, and you do want to go out, then consider necessity. Is this really necessary? Do I need to do this? Is this a good time? Maybe choose times when it's less crowded, where you are at less risk. When you do go out, try to ensure distance. Try and maintain that 6-foot distance. And if you're around people and they're not wearing a mask, politely ask them to do so in order to protect yourself. The other way we can look at this is, how do we stay connected? When we can't go out, many people either are not ready to go out yet, or they have limitations in being able to go out. So learn technology. Have the ability to access others through technology. There are lots of helpers out there. Georgian College here in Barrie, they have students who are willing to help seniors learn how to use their products. There's companies like Cyber Seniors, where you can go on and they have webinars, and they have podcasts, and they have videos, all there designed to help you learn how to use this. And look at virtual programs in order to connect with others. Seniors Without Walls. There are many senior centres that are now continuing, but they're doing it through the computer. So you can contact them through the computer, or if you don't have a computer, through the telephone. Try your best to maintain your connections. There are many resources that can support seniors who are victims of abuse as well. We have the Senior Safety Line. We'll get that up on the screen for you to take a look at, but the number is 1-866-299-1011. Or just simply call 211. If you call 211, they can put you in touch with lots of different resources that are available to you. We are the Prevention of Senior Abuse Network. Check out our website. The Elder Abuse Ontario Network. Check out their website. And remember that there are lots of supports out there. You just need to ask. Thank you.